My name is Nina Lansbury. I'm an Associate Professor in Public Health at the School of Public Health in the University of Queensland in Meanjin, also known as Brisbane. My interest in water is particularly in remote Indigenous communities in Australia. I came to this location of focused, not intentionally. I started with a much bigger question about 8 years ago, asking about Sustainable Development Goal number 6, focused on water and sanitation. And it didn't take long to realise that Australia was not meeting SDG6, and it was particularly prominent in remote and Indigenous communities where there's a whole range of issues, but the summary topic is not everyone can turn on the tap and have a drink of water that is going to be safe in terms of health or acceptable in terms of its characteristics. When we think about obstacles, there's a tendency to think about technical issues, and technical issues are key. I'm not wanting to say they're not part of the story, they're the core part of the story. So what is the source of the water? What are the likely contaminants? And that could be microbial or chemical or industrial. And then what is the appropriate treatment for that water source and for the use in household drinking or other uses. So that's the technical part of the story. And I think that's really quite well understood, because that's the same story as what we have in the city. But what is less a common part of the story, but super crucial to actually achieving that ability to turn on the tap and have a safe drink of water, and they include who's running the system. Are they local water operators? And if they are they well supported, or are they feeling isolated? Are they well trained on the machines they're actually using? Or have they been trained in a different setting and are now trying to adapt skills? If they are Indigenous peoples, what's the cultural competency of the organisations that ideally should be there supporting them? And understanding the ways in which, for example, a local water operator who is running the system for their own community is carrying a lot more responsibility on their shoulders, because it's actually family and community, not just a recipient population. And other aspects are, what's the funding source? I'm based in Queensland, and in our state's remote communities, the funding of water resources in in Indigenous communities is through state government grant funding, which is not sustainable, and it is not how essential services should be funded. And so, taken together, we can have a much more sustainable, bespoke delivery of water. Initially, it sounds much more expensive to set up, but that's setting in place a lot of aspects that will ensure that it's sustainable long term. So I think, firstly, if we just start with talking about drinking water, there's not one repository of data, so we don't actually know all the places and what the issues are, but data needs to be purposeful. So why would we collect data? And really it's to both flag an issue and then to be able to ensure monitoring once there are interventions into the system. So yes, there's a data need. There's also those other aspects I spoke of, sufficient funding and cultural competency by larger organisations that provide guidance into remote areas in support of local staff, and also community awareness of the big role, the big public health, community protection role in terms of health of the population that water operators are delivering. So it's a shift in status of how that role is seen. And there's also understanding that it's not just about a water outcome that meets guidelines when it's tested in the lab. And that's where I say that's potability, and of course that's important. But there's palatability. How does that actually taste, feel, look, smell? And I think any of the viewers would not have to think long to think about whether they would drink something that was a funny colour. When they washed their hair, it made their hair funny, or it was a funny taste, or I coated their appliances in minerals. That becomes unpalatable, even though it might be meeting guidelines. So that has to be addressed. What do people actually want to drink? and how can that water source be adjusted? Because there's a whole flow-on argument that happens if people are rejecting the water that's come out of the tap, even though it might be meeting drinking water guidelines. What do they turn to then? And there's some really interesting work in remote stores about bottled water and where it's placed, how well it's lit, and whether it's chilled and how affordable it is, because it is competing against sugar-sweetened beverages or soft drinks. And that's so high in sugar, and so it has flow-on effects in terms of dental health, weight gain, and impact on diabetes status as well. My one wish would be a common goal that we should all agree in this wealthy country in 2024 that everyone should be able to drink the water that comes out of their tap, no matter where they're located.